So it's the 10th of January and precautionary third doses of the vaccine will be given to health and frontline workers and those senior citizens who are immuno-compromised. There is no need to register for a precautionary dose, and those eligible can directly take an appointment or walk in to the vaccination center as well. These are people who already have their logins on the CoWIN portal, remember. Now, besides health and frontline workers, those who are above the age of 60 and have comorbidities like hypertension, diabetes, other chronic ailments have been given the option to take what the government is calling now a precautionary dose or a third dose of the COVID vaccine. Remember, if you are somebody who has comorbidities, you need to get in the advice of your doctors as well. Those eligible for the booster shots, however, need to have at least 9 months of gap between their second dose and this third dose that they are going for. This third dose, remember, will be the same as people have received in the first and the second. For example, if you got Covishield as your first and second, you will get Covishield as a third, and Covaxin will get Covaxin. There is no mix and match of vaccines, as the centre has said already. So that's where things stand starting today. Let's now also go across to our reporters who are panned across the country, and they bring us up to speed with what exactly the entire rollout process of this third dose is looking like. Ratnadeep Chaudhary joins us now from Assam. Ratnadeep, take us through what exactly are the preparations there. In the past couple of days, we've actually seen cases spike in the northeast. It will be a fine balance of ensuring as people actually get to these centres, there is no outbreak there at least, especially in the most vulnerable lot.
That's right. In fact, in the northeast, we have seen in the past 1 week or so rise in cases in almost all the states, including Assam. Now, in Assam, where the positivity rate was less than 1% on before 1st of January, is now more than 6%, and therefore perhaps the precautionary doses have become very important for the frontline health workers, the other frontliners, as well as people who are senior citizens with comorbidities, and therefore Assam is rolling out along with the country the booster doses from today. The official rollout in Assam will take place at Jorhat in Upper Assam at 11 a.m. However, in many of the CVCs in Assam as well as in hospitals, in medical college, the rollout will start from 10 a.m. and therefore in Guwahati itself about 3,000 people would be inoculated with the precautionary doses. Now, talking about the numbers altogether, there are more than 12 lakh eligible people in Assam who would be administered booster doses. This includes 5,77,000 people with comorbidities whose age are their age beyond 60 years, and they have taken their last dose of vaccine 9 months ahead. So these people are there. Then you have about 2.18 lakh healthcare workers, including the doctors, the nurses, the paramedics, and then the frontliners like the police personnel. They are about 4,33,000. So this is the initial estimate. But however, the state government officials do tell us that this estimates also would particularly for those who have comorbidity and are senior citizens, are elderly people, their numbers will start trickling in with every passing day, because they will become eligible with that limit of 9 months. However, having said that, in Assam the rollout was little late. The initial rollout of the vaccine was little late. Therefore, perhaps from the month of March, you will have more people in the elderly category who would be given the vaccine. So this also gives Assam government a bit of chance to finish off the categories of the healthcare workers as well as frontliners. Also, simultaneously, the 15 to 18 year vaccination is going on, and Assam wants to complete that process where you have 20 lakh beneficiaries by the end of February or first week of March, and they want to finish off both the doses. So that's another challenge which Assam is already handling, and with this you have the rollout of the precautionary dose from today.
All right, so that 9 month gap will actually ensure that there are older people actually turn up to these vaccination centres and for their third dose actually much later in Assam. All right, let's shift our focus to Karnataka now. Karnataka, another state which has seen a massive spike in cases, also a state where we've seen the positivity rate to be one of the highest in the country, one of the top 5 when it comes to Omicron as well. Here, 21 lakh workers, frontline workers, and those above the age of 60 with comorbidities are also going to line up. Shrija joins us now for the very latest. Shrija, what exactly are the arrangements there as we actually see? It's a momentous day. India has been waiting for a booster dose or a third dose for a long, long time. It's going to our most vulnerable lot and also those who got it right in the beginning and perhaps have the least amount of antibodies right now. One question, however, Shrija, is on those with comorbidities. Are they to bring in prescription from their doctors when they turn up to these vaccination centers, or how exactly are they proving their comorbidities here?
Well, at some centers, which is the vaccination centers here in Bengaluru city, while during the first and the second dose, there were several senior citizens who were asked, this is at some centers where they were asked to produce prescription from their respective doctors as far as the comorbidities is concerned. But this time around, all that they have to, even though they don't really have to show a vaccination certificate, yes, some centers are definitely asking for the prescription to understand whether or not they are eligible as far as the booster dose is concerned. But here in Karnataka, we understand it will kickstart at least at around 10 a.m. because the launch will be done by Chief Minister Basavaraj Bommai at Atal Bihari Vajpayee's research center here in the city. And once that launch is done, simultaneous launch will be done across all the districts here in the state of Karnataka. So the number of beneficiaries that we're looking at, like you did point out, 60, above 60 with those comorbidities, the eligible population that we are looking at is at least about 8 lakh, and that apart, nearly 6 lakh healthcare workers and also 7 lakh frontline workers have been identified, which means a total of 21 lakh beneficiaries. The rollout will begin starting today. But what's another confusion that we are witnessing at the moment is, this is after speaking at various PHCs, though the drive has not started yet. What they tell us is that the vaccines have not reached them yet from the cold storage. So once it reaches, only then will they have a clarity whether they will go ahead with this particular drive or not. Because remember, there are certain vaccines that will be kept aside for especially those above the especially 18 years, and then you also have for the youngsters, and then we are looking at vaccines which will be kept aside especially for the healthcare frontline and also those especially with comorbidities for the booster dose. So that particular booster dose, as far as the PHCs and also some of the private hospitals are concerned, that particular confusion is still prevailing whether or not can they really go ahead with the booster dose drive today, because they haven't received a clarity from the cold storage center. That is one, especially to the PHCs. As far as some of the private hospitals are concerned, they say they are in touch with directly in touch with the manufacturers. The manufacturers have not reverted to them, saying that they will be given at least about 100 as far as the booster dose is concerned. Now, what remains to be seen is in the next couple of hours whether or not these PHCs and the private hospitals will receive the booster dose from the cold storage. Back to you.
All right. So that's a challenge there, at least being seen for now. We'll check back with you in about an hour's time, Shrija, to see where exactly this has gone. Also specifying that you may or may not need a letter from your doctor to prove your eligibility as a comorbid person, somebody who has comorbidities and above 60. So that's something we're going to see how it pans out from city to city. For the moment, switching our focus to Delhi now. Now, Prime Minister Narendra Modi, remember yesterday, had underscored the need to focus on testing, genome sequencing and vaccination at the review meeting that he carried out. And COVID, at this time, the fresh infections threatened to spiral out of control, all thanks to Omicron. Now, vaccination for adolescents, he also said, should be in mission mode right now. But this comes at a time, the third dose that is, comes at a time in the national capital when the numbers are spiraling like never before. 22,751 COVID cases, 17 deaths in a single day. Positivity rate, 23.53%. And that is a real reason of worry. Now, we have Akshay Dongre joining us now. Akshay, national capital does not just have the challenge of dealing with Omicron right now, but a huge challenge here is of doctors testing positive. In background of all of this happening, today the third dose actually opening up for this very vulnerable lot. What exactly are the preparations that you're seeing?
Well, Sunil, that's the most important thing, that the number of cases are spiraling at a rate that we have never seen before, because the R naught is at a rate that has not seen ever since the start of the pandemic. As far as the number of cases in the national capital that are coming up on a daily basis are concerned, the positivity rate remains 23%. Now, if we look at a positivity rate of, let's say 21st December, it was 0.2%. So we can say that this is a 10,000% rise of positivity rate. In fact, the number of cases are coming at a pace that the active cases are above 60,000, and we are at a situation that we were seeing in the month of May that was somewhere around at the peak of the second wave, but the number of cases are not going down. However, the biggest point of concern is an argument that is being made by the government that the hospitalization remains low, because the number of cases have come at such a rapid pace that they have increased in a matter of 10 days. Usually the hospitalization goes up in terms of COVID in about a week's time, a week to 2 weeks, when some patients in fact see deteriorating health conditions. So that remains to be seen, that what exactly happens. Also, a lot of healthcare experts are questioning the claim that the number of deaths are low. So while the cases have started to come up now, usually mortality is also seen after a span of 2 to 3 weeks. So that remains a big question, that how exactly the government is making a claim that the situation is under control and not putting more restrictions. There is a DDMA meeting as well today, where the Chief Minister, the Lieutenant Governor, they in fact will be thinking about reviewing the preparedness and restrictions. So remains to be seen that what exactly are the plans to contain the pandemic and spread of Omicron in the national capital, Sonal.
Right. So two important things there, Akshay. One, the DDMA meeting that's going to happen at 12 noon. Correct me if I'm wrong over there. And that's when we get to know if there are going to be any fresh curbs that will be imposed, right? That is one. That is important announcement that we we are watching out for. And the other thing, Akshay, is about these people, the deaths that have been reported. Do we know which vulnerable category is actually still sort of becoming a mortality here, still losing life? We were mostly looking, say in the past week at least, at older people, at unvaccinated people, and those with comorbidities. These are the three sections we saw become the critical number as of this moment.
Well, that remains unchanged, Sunil. These are the three categories that are the most vulnerable even now. Most of the fatalities are happening in these three categories. It's either the people with comorbidities, elder people, or those who are unvaccinated, who are seeing the brunt of worsening cases. Now, the DDMA meeting, yes, will be taking place around 12 noon. Now, earlier there was a decision that was made by the Delhi government that we will go according to the GRAP, that is Graded Response Action Plan, according to which if a positivity rate is above 5%, there should be a red alert in the national capital. But the government said that the hospitalization is low, so we will go slowly as far as restrictions are concerned. And the logic behind this particular argument is that if suddenly a lot of restrictions are put, then we can see another migrant exodus, because a lot of people will lose their livelihood. So that was also a valid argument, but now with the number of cases going up, the government in fact will have to take a calculated approach to contain the number of rising COVID cases, also to secure livelihood for all of these people who are at a risk, who are the most vulnerable section of society. Now, remains to be seen that what exactly are going to be the decisions. Now, whether we will be moving from yellow to amber alert or to orange alert, that will be decided in the DDMA meeting. But the biggest, the simplest solution that we are seeing right now is for the people to themselves, in fact, adhere to COVID appropriate behavior, so that cases do not go up and restrictions are not needed in the first place.
All right. Thanks, Akshay, for joining us at the very latest. We'll keep coming back to you to see what happens, and that all crucial DDMA meeting at noon, we keep a tap on that as well. But it's not just Delhi numbers which are a cause of concern. Battleground UP is actually seeing a massive spike in cases, 13 times this week compared to the last week. UP government says it's gearing up for vaccinating its 15 to 18 year olds, the young adults there, by January 15th. While reviewing the COVID-19 situation across the state in a high-level meeting, senior officials and the Chief Minister there claimed that the government effort is to achieve the target of vaccinating all eligible adolescents in the state by the 15th of January. Special camps should be organized in secondary school as well. But apart from that, what you also see in UP is a massive spike in cases. 7,695 fresh cases have been reported in the past 24 hours. And there is a massive jump that has been seen of 1,300% this week compared to last week. This is about 13 times that we are seeing these cases come up as well. And like we were saying, it's not just the number of cases, but overall the target that the UP government has set for itself in vaccinating all those in the age group of 15 to 18. And they say they will complete that by the 15th of January. That's an ambitious target that has been set by the UP government. There was a review meeting also where they discussed all of that. Apart from that, Uttar Pradesh has suspended physical classes in all educational institutes till the 16th of January. A night curfew will remain effective from 10 p.m. to 6 a.m. in all of UP's districts. This as cases continue to spiral up. Moving on, changes have been made on the CoWIN platform to exclude the picture of the Prime Minister from the COVID-19 certificates being given to people in 5 poll-bound states because of the Model Code of Conduct coming into force. It's been done during the state elections held in April-May 2021 for states going to polls after various political parties complained about it. All right, with that, we're going to slip into a break. Coming up on the other side, Prime Minister's security breach. That case comes up in Supreme Court. We'll take you through the details. Stay tuned. Welcome back. The Aam Aadmi Party has claimed the shocking death of democracy after a BJP leader, the municipal councillor there, Sarabjit Kaur, was declared the winner of the mayoral race in Chandigarh yesterday, beating out Aam Aadmi Party's Anju Katyal by just 1 vote. Sarabjit Kaur and Anju Katyal both polled 14 of the 28 polled votes, but the former was declared the winner after 1 vote in favour of Anju Katyal was ruled out to be, in fact, it was ruled to be invalid. Here's what happened.
The Aam Aadmi Party's victory march after winning 14 out of 35 seats in the Chandigarh municipal polls. And yet, a week later, protests by AAP after it failed to win any of the top posts in the corporation. Mayor, senior deputy mayor or deputy mayor. Days after the results were announced, one Congress councillor switched sides and changed the poll arithmetic. BJP municipal councillor Sarabjit Kaur Dhillon became the new mayor of Chandigarh after she defeated Aam Aadmi Party's Anju Katyal by just 1 vote. AAP alleged foul play when 1 vote was declared invalid.
आम आदमी पार्टी के पास 14 का आंकड़ा है, भारतीय जनता पार्टी के पास 12 का आंकड़ा। भारतीय जनता पार्टी और कांग्रेस की अलायंस हुई तो कांग्रेस ने अपना एक काउंसलर बीजेपी के पाले में भेज दिया, तो हमारा हो गया 14, बीजेपी का हो गया 13, 14 and 13। अगर ये वोटिंग होती तो आम आदमी पार्टी का मेयर बनता। इन्होंने पहले तो अपने वोटों को 14 कर लिया। इन्होंने अपने चंडीगढ़ के मेंबर ऑफ पार्लियामेंट किरण खेर जी को बुला लिया, जो कानूनी तौर पे वोट नहीं डाल सकती।
नहीं, पहले वो डालते रहे हैं, पहले डालते रहे हैं।
मेरी बात सुन लो, उनको बुला लिया और अपना आंकड़ा 14 कर लिया।
Chadha's claims though don't hold up under Section 38 of the Punjab MC Act 1976, which says that an MP can vote in mayoral elections and if there are 2 candidates and the person with 50% and more votes is the winner. Soon after the result was declared, Aam Aadmi Party councillors created a ruckus in the house and resorted to sloganeering. Eventually, police were called to remove them. Meanwhile, the BJP refutes the allegations.
जो एक्ट की प्रोविजन है उसके हिसाब से वो इनवैलिड कर दी गई। इसमें हमारी क्या गलती है? अगर आम आदमी पार्टी का खुद का पार्षद पार्टी से खुश नहीं है या अपने आप को मेयर या सीनियर डिप्टी मेयर या डिप्टी मेयर बनाने जाने से खुश नहीं है, तो ये उनका आपस का अपना अंतर्कलह है। लेकिन जिस प्रकार का दुर्व्यवहार उन्होंने किया, जिस प्रकार का मैं समझता हूं कि सदन की गरिमा को तार तार किया।
The Aam Aadmi Party had said that the corporation results were indicators of how things would pan out in the Punjab Assembly polls. But now, will this setback hurt their chances in the Punjab polls? With Mohammad Ghazali, Bureau Report, NDTV.
All right, so that is where things stand politically, but let's shift our focus back to COVID-19 and the cases that are spiraling in the country. We are truly in middle of a third wave now. And how exactly should you be prepping up, especially on a day when a lot of people will be going out to get their vaccine shots at a time when the virus, Omicron specifically, is spreading like wildfire? What precautions should you take and what exactly are the guidelines? We'll take it forward with our guest now. Joining us this morning, we've got Dr. Neeraj Nishchal. He's Additional Professor of Medicine at AIIMS. Thank you so much for your time, Doctor. We also have with us Dr. Arunesh Kumar, Senior Consultant Pulmonology at Paras Hospital. And also with us is Dr. Vikas Deshwal. He's a Consultant Infectious Disease Internal Medicine Department at Medanta, the Medicity. Dr. Vikas, let me begin with you. A lot of the frontline doctors, in fact, firstly, let me just begin by congratulating booster shot Mubarak, as a lot of people are saying, precautionary dose Mubarak to a lot of frontline and healthcare workers as well. That's if you have a gap of those 9 months that have been clarified by the government. Just want to begin by asking you, how important is it coming at a time, or what role do you see these precautionary shots playing at a time when a lot of doctors, not just in Delhi, but in major metros across the country, sort of captured in the grip of Omicron, a lot of them are now already positive?
So, a very good morning to all our viewers first. I would like to congratulate the government of India for taking out this booster dose vaccination. It is a very welcome step, I would say, because from the data which has emerged from the UK, it is fairly clear that your immunity against Omicron significantly reduces after 25 weeks of your second dose. So in this study, they found out that the effectiveness of vaccination against hospitalization reduced to 52% after 25 weeks of second dose. Whereas if you take the booster dose, that same immunity or the effectiveness against hospitalization increases to 88%, which is a significant jump from 52%. And it is a very welcome step, I would say, taken by the government of India. We all healthcare workers, frontline workers, and those who are eligible for it and those who have completed 9 months from the second dose should go and come forward and take the booster dose, which would enhance their protection against Omicron. And remember, vaccination is the single most important step which would help us end this pandemic.
Sure. Dr. Neeraj Nishchal, if I can come to you, have you lined up? Are you going for your shot today?
Yeah, in all probability, I will be taking today because it's important. If you see the number of healthcare professionals that are getting infected this time is much, much higher. And it's really important that we keep ourselves protected. That's why that's important, because the number of cases, the way it's increasing, if healthcare professionals get infected, then it's going to be a very tough and challenging time. So yes, in all probability, I will be taking it today or latest by tomorrow. So it's important, every one of us who are eligible for this booster, they should definitely take it.
Right. Dr. Kumar, what would you say to those who are saying it's already too late for a booster shot? Now, of course, everyone should take it the minute it becomes eligible. But how would you respond to those saying that we are already in middle of a third wave now? This should have been done, say, much earlier, at least a month earlier.
No, it always says never too late when it comes to good things. When it comes to COVID, we always say that vaccine is the single most effective tool to fight this pandemic. And remember, I mean, if I can talk about medical professionals, we have been dealing with COVID right from long time now. And we had our second dose in February. So we are 9-10 months down the line from the second one. But then, vaccine is one of the source how you generate antibody. There are other ways, which is like getting infections and all. So it's not that we have been completely out of this world. So we have had our another sources, how we have been posing immunity. But certainly what the evidence shows that if you top up your immunity by taking an extra booster dose, it enhances your protection level. So I would say it's never too late. People have been mulling about fourth dose in West, which I think is not right to start with. But, this is how it is. It's about, topping up your immunity by, having a sequential vaccine doses. The duration, how frequently we can do it can be done, depends on how the vaccine availability. And also remember that we have to ensure as well that everybody gets double vaccination first, because that's the first priority.
Sure.
So as the government has decided, I welcome this, because this is a positive step, because medical care professionals, they are getting sick, they are getting infections, and certainly it will go a long way in preventing catching up new infection.
Right. So treat this third dose as a top up to your immunity is what we are hearing from doctors. That's a good way to put it. Dr. Neeraj, if I can come back to you on the issue of older people, those above 60 and with comorbidities. The third rider is that you should have completed 9 months since your last dose. They also are in line today to get their shots, and we'll be hearing from them in just about an hour and a half time. 10 o'clock is when those vaccines will be rolled out. To these people who are stepping out now, and this is a major concern, at a time when a third wave is spreading like wildfire, especially in our metros, what precautionary measures would you ask them to undergo to ensure that, remember what happened when a lot of people went for their second dose, a lot of them ended up contracting the virus while they went for their shots. So this very vulnerable lot, what should they do to ensure that they come out of this safe?
It's very important. Now 60 plus with comorbidities have been the group which has been allowed at the moment, apart from frontline workers. So it's important that whosoever is going to take vaccine, please ensure that you don't have any symptoms of upper respiratory tract infection, which can be suggestive of COVID-19. That's very important, because this Omicron is very, very infectious, and if somebody comes to center with this infection, then there is every chance that he will spread it to others, which may be the case in second wave, which we saw. So it's important that whenever you go, you should be symptom-free, and please follow COVID-appropriate behavior. That is the single most important thing which I will say will help you in contracting this, preventing and contracting this infection. So please wear a tight-fitting, properly tight-fitting mask. It should not be loose. It should not just be for the heck of wearing a mask.
And N95, that works the best against Omicron? Yeah.
The best would be N95, but if you don't have N95, you should be wearing a mask which should have a nose clip which can fit to your contour of your nose. That's important. It should not be hanging on your face. That is all, again, very important. So if you follow this COVID-appropriate behavior, if you do not go to center if you are having symptoms, then these two steps can actually prevent the spread of this infection at the vaccination center.
I see. That's important to remember. Ensure you do not have symptoms when you actually land up to these vaccination centers. Dr. Vikas, your thoughts, and what exactly is your advice to those who are stepping out, especially the elderly, the most vulnerable? Also, I hate to say this, but most of the deaths that we are seeing are of people who are of old age, are of people who have comorbidities, the same lot, which is now going to be stepping out now for their shot starting today.
Yeah, it's very important to understand that the Omicron spread is much more faster than the previous variants like Delta and the Alpha variant. And as Dr. Neeraj rightly pointed out, that two things which are very important for these patients, those persons who are going for vaccination, is first to follow the COVID appropriate behavior. That is, they should be wearing a mask all the time, and they should be maintaining the social distancing at the vaccination site. Also, it is very important for the vaccination sites to ensure that there is no crowding. There should be a strict appointment kind of a system when there are minimalistic crowd at the center, so that there is no gathering or a large number of people are gathering over there. So that should be avoided. So these three things are very important: wearing a mask, second, maintaining COVID appropriate behavior, and third is the crowd management at the centers. So those are the important steps I would say you should take from the person's point as well as from the vaccination centers aspect.
Right. Let me go to Dr. Kumar next, just to get an idea about how this is going to work, especially for those with comorbidities. Dr. Kumar, those who have comorbidities have to, of course, consult with their doctors before they actually step out and consult on whether or not they get a dose, etc. Have you had people, just wanting to share your experience here, have you had people write to you quite sort of proactively and say that we want our prescription so we can get our shot? What exactly is the sentiment you're picking up?
Yeah, actually, most of my patients, particularly those with chronic respiratory diseases, since Prime Minister announced about this precautionary dose, they have been very, very proactive because, in the population which I serve in Gurgaon, most of them are doubly vaccinated, and they have been sort of looking at the third dose and asking, when can I take it? So basically, through your channel, those who have had their second dose, around 9 months back, this is what they have to start with, have opened up for, and have got no acute infection. They are having active COVID or COVID-like or flu-like symptoms, should go and go for their vaccination. There is absolutely, because they have taken 2 previous doses, the type of vaccine remains the same, so there is no confusion there. So those who had 2 co-vaccines before, they are going for third co-vaccine. Those who have 2 Covishields before, they are going for third Covishields. Reaction-wise, the skepticism is less because they have managed all right with their 2 doses. So likely that they are going not to get severe side effects or that sort of thing, because that used to be the major concern, where the vaccine skepticism before, initially. So that is also low. So I would say it's very positive. People are looking forward to it. But very importantly, as my colleague said, that they shouldn't crowd it. You remember, you are going to have a booster dose, but that doesn't mean that you cannot catch infection. So make sure that you don't end up getting a new infection or giving others infection while you are at the vaccination site.
Right.
And for that matter, I think crowd management is so very important.
It is important, but I have another question, and if Dr. Neeraj can answer that as well. Dr. Neeraj, a lot of cases which are emerging out of major metros are actually asymptomatic. So a person does not know if they have the virus already. So how does one go ahead with the vaccine not knowing that?
Yeah, that's why we say if you wear mask, if everybody on the center is wearing mask, then chances of contracting infection will become very, very less. So that's why, my panelists have already said, crowd management and time management, so that nobody is on the center for prolonged time. So if everybody is wearing mask, it's beyond, basically it has been proved beyond doubt that both of them can protect each other. If both
but medically, what can happen, or can somebody who is asymptomatic take a vaccine?
There is no contraindication as such. If somebody is asymptomatic, he or she is not aware of his status. The only problem with is the chances of spreading that infection at the center increase, and that's why we discourage people going to centers, vaccine centers, when they are infected. So if you know that you are infected, you should not be taking that vaccine. But if somebody is asymptomatic, the person is not knowing that he is infected, he or she is infected, then it's not a contraindication as such. He is not going to suffer any severe adverse reaction because of that. So I don't think that should be worry for anyone. If he is asymptomatic, he might get infection because of that.
All right. I think the takeaway from this discussion really is that go take this top-up immunity shot that you're getting. Second, ensure and be mindful of the fact that a lot of people around you could be asymptomatic. So you got to have your guard up, ensure that you have your N95s on, ensure that there is proper sort of spacing out between 2 patients and proper sanitization that is taking place. That's the only way to go forward from here. That's all the time we have. Thank you all for joining us on Good Morning India today. Hello and welcome. It's the 10th of January and precautionary third doses of the vaccine will be given to health and frontline workers and also the immuno-compromised senior citizens starting today. There is no need to register for the precautionary vaccine. Those eligible can directly take an appointment, as you will already have a login at the CoWIN portal, or just walk in to any vaccination center. Besides healthcare and frontline workers, those who are above the age of 60 but have comorbidities like diabetes, hypertension and other chronic ailments will be now eligible for precautionary dose. Remember, the government is still calling it a precautionary dose, not a booster shot just yet. The only catch here is that it should have been 9 months since you've received your last shot, and that really is what makes you eligible for the third dose as well. This third dose will be the same as the first and the second. There will be no mix and match of vaccines. Those who got Covishield will get Covishield as a third shot. Those who got Covaxin will get Covaxin. There is still no clarity on when all the senior citizens or adults in the country will get their booster shot. All right, Sneha Merikoshi from Kerala and Saurabh Gupta from Mumbai now join us for how exactly this booster shot, precautionary shot, third dose, really, what do you want to call it, is being planned across the country. Let's just cut across to them now. Saurabh, to you first. We understand by 10 o'clock is when we can start to see the first vaccinations to take place. The catch really at this point is the timing of this third dose. When the third wave is truly underway and we are seeing Omicron spread like wildfire, how exactly will these centers ensure that they don't turn out to be super spreaders, they don't turn out to be hotspots? What exactly are the arrangements looking like at these vaccination centers?
Well, the arrangements look pretty, decent at this point. You can see chairs have been set up. Also, senior citizens, immunocompromised senior citizens, all, of course, coming in for vaccination. And there is a wheelchair facility, as you can see here, also for those who are specially abled. So all these facilities have been made here. People who need the vaccine will have to be waiting, and then of course when there is the vaccination starts, which is at 10 o'clock, they will be receiving their vaccine. So that's what the process looks like now. The third wave is here in Mumbai. We're reporting around 20,000 cases. Yesterday, of course, it dropped to a little below 20,000, but experts say that the peak is sometime around the end of January, and at that time we might well be reporting around 30 or 40,000 cases as well. So by going by those estimates and going by what we've seen in the last 2 weeks, which is where healthcare workers have started falling sick, as a result putting pressure on hospital facilities, that is something that needs to be addressed, and which is why many say that perhaps this booster dose for healthcare workers should have been given a little earlier, but nevertheless the center has decided, and now of course healthcare workers will start taking it, because if you don't have enough healthcare workers, we already have a shortage of healthcare workers, but within that, if you have more healthcare workers isolating, thankfully this time the infection is not as severe, so obviously they are recovering in 5 days, 6 days and returning to work within a week. But that itself also puts immense strain on the healthcare system, which is why from today healthcare workers will be here, and this is something that we will see over as the day progresses, people coming in for vaccination, and that's something that perhaps many experts say could have been done earlier.
All right. So healthcare workers who actually open up to these vaccines, should that have happened earlier is the question. Sam Daniel also with us, and I see a lot of people behind him. Sam, the same question to you. How exactly are they ensuring that this goes off smoothly, and also that this doesn't turn out to be a hotspot event? We are dealing with the most vulnerable people at the moment.
In a while from authorities, Sonal, but we are at the Image Auditorium at MRC Nagar in Chennai, where in a short while Chief Minister M.K. Stalin would officially launch. And here is the gathering of frontline workers, including police personnel and other health workers. Of course, there is a separate area downstairs where many senior citizens with comorbidities have been asked to assemble separately to make sure they can also get those shots safely. Of course, Tamil Nadu during the earlier phases also had introduced home vaccination so that health officials can go to the homes of the elderly people, for the differently able, so that they don't have to get hassled, they don't have to take the trouble of reaching to these locations. But today alone, they hope to reach out to at least 4 lakh people across Tamil Nadu, and many private hospitals too in their own locations, since now vaccine shortage is no longer there. In their own premises, they're arranging for their own doctors, health workers and people who reach out to public in this exercise. And so far, 85% of 18 plus eligible population in Tamil Nadu have got their first doses. Around 40% of the eligible 18 plus population yet to get their second dose. And this comes at a time when even doctors, health workers in both government and many private hospitals are getting infected. And this is going to help them, particularly Tamil Nadu seeing a spike in numbers severely. 2 weeks ago, we had a daily tally of around 600 cases. Now it's more than 12,000. And Chennai, Coimbatore and a few other districts are becoming hotspots around Chennai. And this, authorities hope, will also encourage people to take their booster shots, as well as who have not done yet, to come and take their second doses.
All right. So we wait to see how that exactly will begin. The Chief Minister there inaugurating those vaccination centers and the drive there of the third dose in the state. Let's go to Sneha now. Sneha, the other big question when it comes to this third shot is that it's coming at a time when there are a lot of asymptomatic patients. A lot of people who do not know that they have COVID are actually turning up also for their vaccine shots. Just want to understand how the preparations are working around that.
Well, what also makes that extremely important, Sonal, a point is the fact that if you look at Kerala, the test positivity rate in Kerala has shot up. From what it would have been around 6, it is now at 11.53 just in a day's time. So that shows the testing also needs to be increased rampantly. But even if we talk about the numbers, and you're talking about the daily numbers, that has seen huge spike. We've reported around 6,238 COVID cases on Sunday. And that, if you see, is almost the highest that Kerala has reported over the last 2 months. So these two becoming extremely important developments at a time when these vaccinations are being opened up to the health workers as well as senior citizens. We've had some of them who've come in. Many of them are sitting inside the observation room after taking their initial vaccines. Vaccine kiveni vandadano. മൂന്നാമത്തെ ഡോസ്. പേര് അബൂബക്കർ. എത്ര വയസ്സായി? 71. രജിസ്റ്റർ ചെയ്തോ?
രജിസ്റ്റർ ചെയ്തിട്ടില്ലായിരുന്നു. അതായത് മൂന്നാമത്തെ ഡോസ് ഞാൻ ഡൗൺലോഡ് ചെയ്തിട്ടില്ലായിരുന്നു. വാക്സിൻ ചെയ്ത് എൻ്റെ സെക്കൻഡ് ഡോസ് ഡൗൺലോഡ് ചെയ്ത് അത് സർട്ടിഫിക്കറ്റുമായിട്ട് വന്നാലേ എടുക്കുള്ളൂ.
അപ്പം സർട്ടിഫിക്കറ്റ് കയ്യിലുണ്ട്, പക്ഷെ ഇവിടെ കൊണ്ടുവന്നിട്ടില്ല.
ഡൗൺലോഡ് ചെയ്തിട്ടില്ല, ഇതുവരെ ഡൗൺലോഡ് ചെയ്തിട്ടില്ല. അതിനെ കുറിച്ച് അറിയില്ലായിരുന്നു.
അപ്പം എന്തോ ആയിരിക്കും ഇപ്പം ചെയ്യുന്നത്?
ഇനിയിപ്പം ഡൗൺലോഡ് ചെയ്യുക, ഏതെങ്കിലും അക്ഷയയിൽ പോയി ഡൗൺലോഡ് ചെയ്തിട്ട് പിന്നെ വന്നെടുക്കുക.
അപ്പം ഇവിടെ ഇരിക്കുന്ന കാരണം
എൻ്റെ കൂട്ടത്തിൽ വന്ന ഒരാളിനെ കൂടെ കൂട്ടിക്കൊണ്ട് പോകാൻ.
Right. Thank you, sir. So here, you know, these are some of the initial challenges that you would have with senior citizens. പേര് എങ്ങനെയായിരുന്നു, sir?
Abubakar.
So Mr. Abubakar has come here for his third dose, the precautionary dose, but he did not download his certificate for the second dose of the vaccination. So he has to go to one of the government outlets, download the vaccine, because they don't really have the comfort of downloading it on their own phone. They don't know the how to do that. So that being one of the challenges here, you can see registrations are going on to my left as well as my right here, where people are coming in and registering. You can see senior citizens here as well. Now, Sonal, what is important, and this needs to be shown, is while this is the reality, you may not see large numbers of crowd here, but just, and I can't pan this and show to you, but let me just try, if a camera person can just pan. We are at the general hospital and there's an outpatient wing right there. The kind of lines that are there, all just so close to each other, perhaps only another indication of what could be a challenge, if at all we have a mass spread of COVID, and you can see the COVID cases increase to a large extent. And we've just walked across to this line, and you can see this is not the vaccination point, this is not the vaccination line, but this is the general line outside for the outpatients. And here is the challenge, even as the COVID numbers spike.
True, and if there were a spread, it would all happen around the hospital, the same hospital where the sick and those who want to get vaccinated are going. And again, just want to underline, this is our most vulnerable lot, our seniors above 60 and those with comorbidity. So that remains a challenge. Sonakshi also with us from the national capital. Sonakshi, take us through what exactly are the preparations looking like at a time when Delhi is seeing an outburst of cases at this moment, and also to underline, a lot of them turning out to be asymptomatic. These people might turn up to the centers to get vaccination as well. How are they ensuring that the entire area and the entire process is streamlined and is sanitized in a way that it doesn't turn out to be a hotspot?
Well, absolutely. A very good morning to you, Sonal, and to all our viewers. And Delhi is gearing up to boost our 60-plus population, gearing up to boost our health care workers and frontline workers. We're looking at a hospital here in the national capital, the RML hospital, where we're told that the vaccination, in fact, inside has begun. We are looking at people coming in and also doing a walk-in registration, and some already who have an online appointment. We are of course not allowed to go inside at the moment, but these are just a brief exterior shots from the entrance of the RML hospital, where vaccination has begun for 60 plus for the healthline workers, frontline workers and healthcare workers at the same time. But we're also seeing that Delhi is seeing a frightening surge of the COVID cases, of the new variant Omicron cases. We've looked at over 22,000 cases just yesterday. Now, just to break it down in terms of numbers and figures, we're looking at least 3.5 lakh healthcare workers in Delhi alone. We're looking at least 3.8 lakh population that is 60 plus, and we're also looking at 5.3 lakh frontline workers in Delhi. In terms of preparations, the Delhi government has geared up completely, and they have in fact urged private hospitals to go ahead and vaccinate and give that precautionary dose, that booster dose for all their medical staff. We're also looking at different vaccination centers, existing vaccination centers, to be used up exactly for this activity of vaccinating those 60 plus. At the moment, we are actually at the hospital, but we're not allowed to go inside. But we know and we're made to understand the vaccination has started for 60 plus and for our healthline and frontline workers. We're also understanding that walk-in appointments are also allowed. If you already have an existing account on the CoWIN, that will be taken. If you want to take an appointment beforehand, that will also be allowed. The arrangements made, district magistrates have been urged to participate in this and make sure that as many as people can come in and get vaccinated for this booster dose. So at the moment, we're just looking at some people walking as well. But through the day, we will be getting more updates. We will be seeing more people coming, and we will be giving you all those updates. But Delhi has geared up, and Delhi has kick-started those precautionary doses and booster doses for the 60 plus age population.
Right. So Delhi waking up slightly late in the winter for their shots, really. We yet to see some people actually turn up on those vaccination centers. But to Saurabh, Sneha, Sam and Sonakshi, thanks so much for joining us with the pan-India approach on how exactly the rollouts of the third shot is actually taking place. We've seen South actually come up in big numbers in both Chennai and also in Trivandrum. We see huge numbers where people have actually turned up. We wait to see how exactly this pans out. It's happening when the third wave is truly underway. So how the rollout happens is going to be very, very closely watched out and hopefully done with utmost precaution. All right, we spoke about 4 states. Let's also go to Karnataka, where Shrija is bringing us this report on how exactly Bengaluru is gearing up for their third shot.
At some centers, which is the vaccination centers here in Bengaluru city, while during the first and the second dose, there were several senior citizens who were asked. This is at some centers where they were asked to produce a prescription from their respective doctors as far as the comorbidities is concerned. But this time around, all that they have to, even though they don't really have to show a vaccination certificate, yes, some centers are definitely asking for the prescription to understand whether or not they are eligible as far as the booster dose is concerned. But here in Karnataka, we understand it will kickstart at least at around 10 a.m. because the launch will be done by Chief Minister Basavaraj Bommai at Atal Bihari Vajpayee's Research Center here in the city. And once that launch is done, simultaneous launch will be done across all the districts here in the state of Karnataka. So the number of beneficiaries that we're looking at, like you did point out, about 60 with those comorbidities. The eligible population that we are looking at is at least about 8 lakh, and that apart, nearly 6 lakh healthcare workers and also 7 lakh frontline workers have been identified, which means a total of 21 lakh beneficiaries. The rollout will begin starting today. But what's another confusion that we are witnessing at the moment is, this is after speaking at various PHCs, though the drive has not started yet. What they tell us is that the vaccines have not reached them yet from the cold storage. So once it reaches, only then will they have a clarity whether they will go ahead with this particular drive or not.
All right, with that, we're going to slip into a break. When we come back, more on the COVID numbers which have just come in. India has gone past 1,79,000 in the past 24 hours. Our Omicron figures are above 4,000. Details in a moment from now. Well, the numbers on the latest COVID figures in the past 24 hours have just come in. Let's take you through that. At the moment, in the past one day, 1,79,723 fresh people have been infected with COVID-19. The weekly positivity rate at the moment stands at 7.92%. Daily positivity rate at a whopping 13.29%. The cases there inching closer to the 2 lakh mark. At the moment, these are 1,79,723 people who have been infected with COVID in the past 24 hours. Let's look at the Omicron figures also now, which have crossed 4,000, and out of those, about 1,500 have recovered. The states that continue to see those highest Omicron figures are Maharashtra, Rajasthan, Delhi, Karnataka and Kerala, coming in on the top over there of the latest in Omicron figures. Over 4,000 there, and this is again because it takes time to do genome sequencing, and India is particularly slow on this one, and this could just be the tip of the iceberg here. All right, moving on now, and let's bring you the latest from UP, which has also seen an outburst of cases. In the past 1 week alone, cases have gone up 13 times. It's an election-bound state where in the past 24 hours, 7,695 new cases have come up, which is 13 times, like we said, recorded last week. The cases recorded on Sunday were 552. The biggest figures have come from the capital, Lucknow, where over 1,000 cases have been reported. In Noida, again, over 1,100 cases over there. And this comes at a time when a lot of night restrictions have been put in. Alok Pandey joins us on the phone line for the latest on this. Alok, at the moment, all right, we have Alok live. Good morning, Alok. Just take us through these cases and how exactly it's looking like. We know that there have been restrictions put on rallies in poll-bound UP at the moment, but suddenly in the past 1 week, we've seen these cases spike up.
Well, yes, I think Uttar Pradesh is facing a double challenge, Sonal, both of these infections rising and also of vaccination. I'll talk about the infections first. You are absolutely right. In the past week, the number of infections being reported had spiked up a lot. So last Sunday, which was about 8 days ago, the state reported 552 fresh COVID infections. Yesterday, which was a week later, the state reported 7,695 fresh cases of the COVID infection. Now, this is a 1,300% jump in just 1 week. In terms of absolute numbers, it may look a little small as compared to, say, what a Mumbai or a Delhi are going through. But then you see the reporting standards of Uttar Pradesh have also been debated in the past. The concern is that these cases could rise much further and at a much faster rate, coinciding with the start of elections, and that's something that authorities are worried about. One thing that they point out is that hospitalizations are less, and over 90% of these people who are being infected are in home isolation. But as per our experience with this virus in the past 2 years, this really could change dramatically. One hopes it doesn't, and that is the concern. The other worry for Uttar Pradesh is vaccination. Just 53% of the state's eligible population is fully vaccinated against COVID. I say fully vaccinated because that is the benchmark of protection against this virus. This rate, while Punjab and Manipur have rates that are worse to this rate is of particular concern for a state like Uttar Pradesh because this is India's most populous state. Now, in the past, we have reported on how, authorities say that they are trying to ensure more and more double dose coverage for everyone who is eligible, but they are facing problems. Some people don't want to come, some people are lazy, etc., etc. But at the end of the day, these figures are concerning because the elections start in just a month. And can this figure go up to, say, 70%, 80%? That's debatable because that will be then, again, a benchmark. Pardon me for repeating myself, for conducting safe elections. So that's a concern. Simultaneously, the booster dose or the precaution dose is starting today in Uttar Pradesh. I don't have numbers for how many people are being targeted, but that will also come in later in the day.
All right. Thanks, Alok, for joining us with that, particularly a challenge in a state which has seen one of the lowest overall vaccination rates as well. So that puts a larger population in terms of sheer numbers at risk of getting the virus and also of them actually landing up in hospitals in a state which already has a very poor medical infrastructure. So how exactly this caseload is going to be dealt with once it escalates is something that we'll watch out for. Thanks, Alok, for joining us with those details. We're going to slip it to a break now. Coming up in just a moment, we'll be talking to doctors. Also remember that all crucial DDMA meeting where further curbs in the national capital will be decided. That's coming up at 12. We'll bring you the details in a moment from now. Welcome back. Now, today is also the all-important day when the DDMA, that's the Delhi Disaster Management Authority, meets up and they will decide if fresh curbs are required in the national capital. National capital where cases have been spiraling. There has been a massive outburst of cases. If you look at in the past 24 hours alone, 17 lives have been lost and over 22,700 people, fresh people, have contracted the virus. The positivity rate is at 23.53%. That is your positivity rate in the national capital, which is also the highest we've seen since the 7th of May. Now, Akshay Dongre with us now with the very latest on how exactly it's looking like. Akshay, the DDMA has played a crucial role in deciding which way and what kind of curbs will be enforced. Delhi, we've seen very proactively enforce curbs. The first in the country to start a weekend curfew, and soon after we saw a lot of states go that way as well. Delhi hasn't shied away so far, the government and the administration here, from putting in fresh curbs. But at a time when more and more hospital beds remain vacant, but also more and more doctors continue to get the virus, and on a day when the booster shot or the third dose is being given out, which way are they swinging? Do we have an indication so far?
Well, Sunil, yes, as far as the curbs are concerned, Delhi has been proactive in putting new curbs, and that is because during the first and the second wave, the national capital has seen how bad it can get. We have seen during the second wave that the national capital was struggling for even oxygen. In the hospitals, there were no beds available, no matter if you want to go to a private hospital or a government hospital. So it was extremely bad. The national capital and the government of Delhi is in fact, wants to be prepared for a similar kind of situation, and with the number of cases that are going up and at a rapid pace, they are now looking at all the possibilities, all the options that they have to try and break the chain of transmission, and restrictions are the only way out as of now. So we have seen that the government has said earlier that till the time hospitalization doesn't increase, they will not be putting in new curbs. We have been at the yellow alert for a very long time now, despite the number of cases going up, and with a positivity rate of 23%. We can see that how the situation is going from bad to worse, and while the red alert, according to the GRAP method, should have been implemented over at a positivity rate of 5% for 2 consecutive days, it was not done to prevent any kind of migrant exodus. But now the DDMA has a meeting today, and the Chief Minister will be a part of it, Lieutenant Governor will be a part of it, and they will be deciding on new curves. We cannot expect a red alert so soon, because even during the weekend curfew, we saw public transportation work, and in a red alert, even metros, taxis, buses, public transportation will not be functional. So we cannot expect a red alert so soon, but yes, there will be fresh curbs that are expected, because the number of cases are going up, and we have seen how COVID works. It does not even increase, it does not result in increase in the number of cases and people going to the hospital, but also doctors get infected, which decreases the workforce of the hospital, so that overwhelms the health infrastructure. So that is a big cause. And like you have been mentioning, that a lot of doctors are testing positive in AIIMS, Safdarjung, different hospitals across the country. So that remains the biggest concern, Sonal.
All right, so 12 noon is when that meeting will start. Last time around, the Chief Minister had just tested positive the same day and he could not attend. We wait to see what exactly happens this time. Will the Chief Minister attend, or will he weigh in on this matter? And what exactly is going to be the life for Delhiites like you and I, to see which way this is going to go. Thanks, Akshay, for joining us. We'll keep returning to you for the latest updates on that story. But talking about Omicron numbers, let's bring in our doctors now. Joining us is Dr. Rahul Pandit. He's a member of the National Task Force appointed by the Supreme Court, and a member of the Maharashtra COVID Task Force as well, Director Critical Care at Fortis Hospital in Mumbai. We'll be very soon joined by Dr. Garg and Dr. Grant as well. Dr. Pandit, if I can just start by asking you, this is a day when the most vulnerable population in the country goes for their immunity top-up, right? They are going for this top-up, and along with our healthcare workers and frontline workers, at a time when a third wave is truly underway. And the third factor here is that a lot of Omicron patients and people are turning out to be absolutely asymptomatic. How worried are you, or if you want to talk to us a little about how cautious really one needs to be when they step out to these vaccination centers, because the worst thing that really can happen right now is that they turn up into hotspots?
Absolutely. Good morning. I think there needs to be a little bit of caution in senior citizens as well as in healthcare workers who are going up for their additional dose today. So what they need to understand is that if they have come into contact with anybody who was positive and they were exposed, that means they were without a mask, or the person who was infected was without a mask, then they should wait for at least 5 days, do their test, and then go for their additional dose. Second thing is that if their family member has been exposed, then just be cautious about rushing for a boost-up dose right now. Just again wait for 5 days, do a test, make sure that you are negative, and then you can go for that. Most importantly, when you're actually going for the vaccination, double mask. Make sure that you actually follow all COVID-appropriate behaviors, because last time around, during the second wave and just before the beginning of the second wave, we actually saw huge crowds at the vaccination center. And those vaccination centers were sort of thought to be one of the spreader events or a super spreader events, where a lot of people got infected just immediately after taking their vaccine dose.
Yeah, and the symptoms also were so similar of when you get COVID and post-vaccine as well. So people got a little confused into how to deal with it actually.
Absolutely, because the symptoms can mimic. You may have a little bit of fever for a day or two, and you may dismiss it off as a fever post-vaccination. And in the meantime, you may actually infect rest of the people in the house. And with this Omicron variant, the infectivity is so high that within a day or two, the entire family is becoming positive. So I think this is a very cautious time for everybody to think. We've got to apply some amount of understanding and some common sense that you will only go across when you're absolutely sure that you have not been exposed to anybody and you have nobody in the house which is positive. But one thing is for sure, all of you should go across who are eligible and take that additional dose. There is no second doubt about that. The only thing is that you need to restrain caution if you have been exposed to somebody.
Of course, this is not to discourage people from taking their third shot at all. This is just to say that be cautious of what environment you're going in and take charge of your own health right now and ensure that you might be asymptomatic, somebody next to you might be asymptomatic. So always have your N95 on and maintain enough physical distance as well. Sanitize the areas that you're sitting on and areas that you're touching. Dr. Rakesh Garg is also with us. He's an additional professor, critical care at AIIMS. Dr. Garg, I was just asking Dr. Rahul Pandit the same question, that we need to very cautiously get into this third shot and get into hospitals at these times. I was speaking to colleagues of mine, especially down south in places like Trivandrum, in places like Chennai, where a lot of people have turned up. And we need to be very, very careful that these places do not turn out to be super spreader events, and also ensure that people still come for their third shot. What is your advice to people, apart from what we've already talked about, of course, of maintaining COVID appropriate behavior? And I just want to get clarity on one more thing. If you are asymptomatic and you of course don't know that you have COVID, if you go for your shot, medically, is there any downside to it?
I think it's a very, very important question, Sonalji, you have put up. First point regarding the booster doses. So wherever feasible, when we are talking about the high-risk population or those who are exposed to taking, like frontline workers, now these are the right person who should definitely go for a booster dose, because these will be the person who will be managing the show or the present pandemic which is ongoing. So they need to take their own precaution, because we are seeing even in the second wave and even the third wave, the frontline workers are getting infected because they have to be on the duty. So they can go ahead for the booster dose. But having said that, the vaccination or a booster dose does not mean that you will not take COVID appropriate behaviors. They will just decrease the severity of the infection in case if it happens, but it will not bring it to 0%. So even if you take booster doses, you have already been vaccinated, please do follow all the COVID appropriate behaviors. Just not wearing the mask, but wearing it appropriately is another important aspect.
And wearing the right mask. A cloth mask does not work against Omicron, that has been proven.
Absolutely, and seeing the infectivity of this virus at present, it is very, very important that you need to wear round the clock of the proper mask, which should be, especially those who are in contact with person or have to move around, they should be wearing this mask. The other aspect which is of a concern, as you mentioned, the asymptomatic period, though we do not have much data for it, but yes, when we say the asymptomatic, the viral infection itself will create immunity. But if you do not know about it, I think if absolutely asymptomatic, the getting an test, RT-PCR or any other test prior to booster dose is not suggested. So go ahead and get it done. So it should not be a big issue, because that will just boost up your immunity. The third aspect which is important is even if you are going out and wearing a mask, because in this wave, a lot of patients are mild or asymptomatic. And it has been seen that if you communicate to a person in a close vicinity, even with some social distancing for prolonged periods, more than 10, 20, 30 minutes, the chances of getting infections are very high. So don't try to have continuous face-to-face interaction with people for a longer duration. So just try to have break in between in case if it is very important to talk to that person, maintain a social distance. But if you keep a very big distance, maybe some important work, especially the official duty for frontline workers, may not be possible. So in those situations, you need to be maintaining that break in between rather than a continuous interaction for a longer duration with your mask absolutely on.
With your mask absolutely on and no downside to, so don't be worried that what if you're asymptomatic and you'll take the shot. So there is no downside to that is what the doctors are saying. Go, still get ahead and go for your third shot. Dr. Parvez is also with us. He's the managing trustee, the Grant Medical Foundation, member of the COVID task force in Karnataka. Dr. Parvez Grant, thank you so much for speaking with NDTV this morning. I just want to get your view on the third shot finally coming in to our most vulnerable population right now, but coming at a time like this, coming at a time when a third wave is, there's an outburst or it's spreading like wildfire really. So at a time like this, we've been talking about precautions that people need to take when they actually turn up to these vaccine centers. Your thoughts?
See, as far as the third shot is concerned, I think it is extremely important that everybody be given the third shot and as quickly as possible. Now, what we have found is that people who are taking the Covishield, the third shot has not been so effective. But the new vaccine that is coming out from Serum Institute, the Covovax, is very, very effective. In fact, against the Omicron virus, if you've taken the new vaccine of Serum, we are finding fantastic results.
Okay,
and,
even against
I'm
Omicron?
told that, sorry?
Even against Omicron?
Yes, against Omicron, it is extremely effective. And I think it is more than 90% effective against Omicron. I've had a long chat with people at the Serum Institute because I'm from Pune and Serum Institute is very closely associated with us.
Just to point out, Doctor, it's not peer-reviewed so far. This is what the company is claiming.
Yeah. But the company has already got 200 million doses ready. And it has already got recognition for to be given in the public. So I think very shortly this new vaccine will be given to everybody. And once this vaccine is given, you will definitely find that you will not get infected once you've taken the vaccine, possibly after 10 to 12 days after taking the vaccine. So this is the new thing that is coming out. It's called Covovax, and in America it's called Novavax. So this vaccine is what is going to come out in a very, very big way, very, very shortly. And with this vaccine, I'm sure people will definitely get protected. But in the meantime, we need to take, as you mentioned, all precautions. Now, let me explain what is the situation in my own hospital in Pune. At present, we have got 52 patients admitted with the virus. Out of the 52, nearly 75% are the Omicron and only 25% are the old Delta wave. Having said that, in the hospital at present, nobody is on ventilator and only 2 people out of the 52 are on oxygen. So what we are finding basically is that this is a very, very mild virus. This is a virus that will shortly go up. The number of cases will shoot up drastically, but as it goes up fast, it will also come down very quickly. Most of the patients I'm seeing are completely asymptomatic. In fact, myself also got infected last week, but within 5 days, everything was all right. The only symptom I had was mild fever, which lasted for about 2-3 hours, 99, and went away. So don't get worried about this virus. It's a very low intensity problem, and I'm sure as more and more
don't
people...
get callous either. Don't get callous either. Yeah, you have to be very cautiously looking at this virus as well. Dr. Parvez, if I can also ask you, you said there are 2 people on oxygen support. We've been trying to understand who these people are. They are unvaccinated, they're those with comorbidities, or they're older people?
No, these people who have been vaccinated and have taken 2 doses get very, very mild symptoms. Those have not been vaccinated and those who have got comorbidity, like if you've got, rheumatoid arthritis, or if you're severely diabetic on insulin, or if you've got, you're very old, if you're 90 plus, 80, 90 plus, then obviously your comorbidity is there, and these are the people. Also, I must add people who have got blood pressure, hypertension, and people who have got coronary artery disease. These are the people who sorry, I think we got cut off. These are the people who have got a very high incidence of comorbidity, and these are the people who can get into serious trouble.
All right, people with hypertension, people who have problems in the heart also need to be very careful with this third wave. Thank you so much, doctors, for joining us with that perspective. And good luck with your booster doses today. As let's end on that bright note, at least it has begun. And we wait to see how exactly it will pan out. Thank you so much for your time. We're going to slip into a break. News continues on the other side.
Thank you.